Hi, I'm Tabitha McGee. I am the CEO of the Sickle Cell Foundation of Georgia, and I would like to say welcome to Beyond the Show. This is a companion podcast to our very first episode series, which is Unveiling Sickle Cell Beyond the Pain. I'm so excited because today I am here with a good friend, but more importantly, someone that advocates every day for sickle cell disease. And his name is Andy Lord. And Andy Lord has been a lobbyist with the Sickle Cell Foundation of Georgia for well over 10 years. He's volunteered, so he knows this industry inside and out. And so I'm really excited to have my friend join me today for Beyond the Show, where we're going to delve a little bit deeper into our topic that we started with on Unveiling Sickle Cell Beyond the Pain. Welcome, Andy. I'm so excited that you're here.
I'm excited to be here.
So, Andy, you know, you was one of our first guests on Unveiling Sickle Cell Beyond the Pain. And we started some conversation there about sickle cell. But what I would like for you to educate individuals on is that sickle cell just doesn't affect African Americans, although it's predominantly African Americans, but it affects other races as well. So why don't you share your story?
Well, my story is goes back a number of years. Importantly, when I was born, sickle cell testing was not part of routine metabolic screening in Georgia. It was not part of every live birth testing as it is now. And so for years and years, we missed so many opportunities to early detect sickle cell disease. However, by the time my son was born, they had added sickle cell screening to the routine metabolic screening panel with every live birth in Georgia. And so we started then detecting it. So as it turns out, my son tested positive for sickle cell trait. Now, my wife is also white, so this was a big head scratcher for the doctors. And in fact, my pediatrician was so sure initially that it was a mistake that they didn't even call us to tell us about the result. Mm-hmm. They retested my son's blood for sickle. Sure enough, it came out positive again, and only then did my pediatrician call and say, "Hey, your son just tested positive for sickle cell." And they did say trait, but they had left that on a voicemail. And so all I heard was sickle cell. And of course, I Googled that immediately, and my screen filled up with things that terrified me.
Of course.
So I tried to call my pediatrician back. They were closed. I got on the phone I called Emory Hospital at random. I was just kind of in a panic trying to understand what I now needed to do for my child. And, this is the plight of sickle cell families, of course, right? You're all of a sudden thrust into, what do I need to do next?
Right.
And where do I access services? And so I called Emory. I was transferred 24 times. I end up on the phone with the geneticist at Emory. I'm sharing with him my story. I just got this voicemail from my pediatrician. He interrupts me, and I will never forget how he framed it. He said, I'm so sorry to interrupt, but I need to ask you an indelicate question. And I said, yes, of course, anything. And he said, you sound white. And I said, that's a true story. And he says, and your wife? And I said, yes, her too. And he goes, I'm on the phone with the geneticist at Emory that's just scratching his head. And then, he walks me back through it, and he says, did they say trait or did they say anemia, et cetera? And I told him it was trait. And he said, okay, you can take a deep breath. And, he goes on to explain to me the ramifications of having the trait, yet how still uncommon it is, particularly in whites. So I then, of course, started an exploration within my family. I went to my oldest living relative at the time, my grandmother. I asked her, hey, what can you tell me about this? Mm-hmm. And as we now call it, famously the sweet tea story, she just looked at me with a frozen look for a minute. I said, Grandmother, what can you tell me about this? And she just got a frozen look and said, more sweet tea? As we sat there at her kitchen table. And she would never tell me.
Wow.
She would just never share. But I could tell by her reaction that she knew. Because she wasn't like, sickle cell, what's that? Because
Right.
that's what I was like
Right.
when I got the call.
Right.
And so I could never get her to tell me, but in talking with some of my other family members, my dad, my uncle, my brother, obviously my son, and myself, I went and got tested. When I learned this from the pediatrician, I went and got tested. My wife went and got tested. It was me.
Okay.
That's when I started backtracking it through my family. And they were all like, oh, yeah. My uncle said, hey, when I went into the military, they did test for this.
Oh, wow.
And that's when my uncle found out, is when he went into the Army. And he was, I think, 20 or 21 at the time. So he had not
So it's more than just you and your family that has sickle cell trait. You have brothers and uncles that have sickle cell trait as well?
my brother, my uncle, my dad, my granddad, and my son. So this has hit every single generation in recent.
Okay.
My brother did do he actually hired a genealogist. And the best that they could determine was that one of my great-great-great-great-great-grandfather, going, way back, was a traveling minister that apparently had 3 families, one in Louisiana, one in Georgia, and one in South Carolina.
Whoa.
So somewhere in that, as best we could trace it back, it appears to have come from that grandfather on my dad's side.
Okay.
That the genealogist traced it back to. So that was that was the beginning of my sickle cell journey.
Okay.
In understanding, and of course, as so often happens, when you learn of something that has impacted yourself or your family, sometimes that's what it takes to get us involved.
Right.
Right. And so the first thing I did when I found this out is I said, hey, what do I need to do to engage to be part of the solution? And I reached out here to the Sickle Cell Foundation and said, I want to do anything I can to help. Tell me what I can do. I'm a white guy. Plug and play. Where do I fit into this?
Right.
And this was, of course, when Deb was here.
Right.
And she said, well, I just want to start out. I've got all these health fairs. I've got some presentations you could make. So I started going around the state to health fairs, to sickle cell events. I would just stand at our table while we were giving out materials, educational materials, stuff. That's where I really came into the foundation. It's just, let me just volunteer. Let me be part of the solution. It wasn't until a number of years later that there was some funding that came through that allowed for some advocacy work. I was already a lobbyist. Deb called me down here and said, there's no job application. You've been doing this. You're a lobbyist. We want your help at the Capitol. And
Absolutely.
That's where that intersection finally happens.
So you and I have similar stories. We started off at the foundation as volunteers. And, like you, I did have a classmate that was very sickly, but we really didn't know what was wrong with him because no one ever educated us on what sickle cell was. Yeah. But as I started having memories, I started thinking about this young man, and unfortunately he didn't make it. But I'm like, that was sickle cell. So when I first moved back to Atlanta, and I asked my mom, who do you know that's hiring? And she's like, oh, your sister over there at the Sickle Cell Foundation of Georgia needs some help. And I was like, who? She's like, Deb. And I was like, Deb? I said, what is Deb doing now? And she's like, oh, she works for the Sickle Cell Foundation of Georgia. I was like, what is that? And she was like, go look it up. So I went online, Googled it, and the website came up, and I was like, okay, this seems interesting. So called Deb. She invited me to come over. So Deb and I sat down and we spoke, and she was like, I really would love for you to be a part of the team. I really need you for your IT background. I have some computers and my servers. I'm having some problems. And I'm like, okay, certainly. And then I asked her, what could she pay? And she told me the number. I said, I'm just going to volunteer because you can't afford me right now. I'm just going to volunteer so you don't insult me.
Nonprofit world,
right? Nonprofit world. I'm like, and that's so different coming from corporate America, coming to nonprofit space.
Doubt.
It's completely different. So I got started with them volunteering, of course, cleaned up the server, the networks and all that. But it wasn't until I started meeting the individuals or the humans impacted by sickle cell that it really caught my heart. It caught my attention. Yes. I was like, you know what? I want to be a part of this. I really want to help. And it gives me an opportunity to do something that I couldn't do for my son. So my son, Melvin, at 20, he passed away due to epilepsy. And a lot of the same things that they were doing here at the foundation were the same things that I was doing for my son, advocating for him, a caregiver for him. I had to walk away from corporate America because my son was very sickly to help, take care of him. And so I was like, this is so similar. So I wasn't able to save my son, but let me see how many more sons and daughters, that I can save on this side. And it has been a fulfilling purpose. I believe I finally found my purpose. It's been so fulfilling when I wake up every morning coming to work. It feels good knowing that you're coming here and you're advocating for individuals, humans, I don't want to call them individuals, but you're advocating for warriors who really need someone to get their voice heard, right? You are bringing the public aware of this horrific, chronic, painful disease. And there are so many stereotypes and social stigmas associated with sickle cell that we want people to know. That's why we started the first show, Unveiling Sickle Cell Beyond the Pain. It's not just pain that they're contending with. There are so many other factors that's involved in that. And so I really want you, if you don't mind, first share with us, how is your son's health today?
His health is great.
Okay.
My health is great.
Okay.
As you know, with the trait, there's a handful of things that a trait holder has to be careful of.
Right.
And it's being at very high altitude,
Yep.
unpressurized,
Yep.
way below sea level,
Yep.
unpressurized. And what I learned even later is that with the trait, you can have a precipitous drop in body temperature
Yep.
if you go under anesthesia.
Absolutely.
And I learned that from a nurse at the Capitol,
Okay.
actually. She told me, we have to really be careful anytime we're putting somebody under anesthesia. I've never been under anesthesia.
Okay.
But had we not captured my son's condition via his test, which was some of the great groundwork that was laid to get that added to metabolic screening, predating even our involvement
Right.
with sickle cell. Had we not had that success, I may not know today. And there's not an ER in this country that if I got taken in there and they had to put me under anesthesia, that there's
would ever think about
there's no
sickle cell.
doctor in that OR that's
Right.
going to be like, well, let's make sure he doesn't have anything sickle cell, right?
Right.
And so that is the importance of it. But those are the only things I have to be cautious about.
Well, there's one other thing, overexerting.
Extreme
And
exertion and
heat
extreme heat, yes.
or cold. And so you do have to be careful about that.
That's
A lot
right.
of people have not been educated about sickle cell trait. Of course, when they hear the disease, they know like, okay, this is serious. But when they hear sickle cell trait, they sweep it on the carpet. I just have trait. But I just finished doing an interview with WSB TV because we had many recruits for the fire department and the police department that were passing away because they had sickle cell trait. And no one had ever educated them on the dire consequences that you can undergo if you have sickle cell trait. And so there's a lot of football players, we see them sitting on the side of the line with the oxygen tank on. Yeah. And they may not have been educated to understand that if you go to high altitudes, so when a lot of them going to Denver, Colorado
Yes.
and all that,
Yeah.
they can actually, have a crisis. When they're going to a helicopter, it's not pressurized, they can have a crisis. When they're overexerting themselves either way, when they're out there training. So think about the intense heat and the number of hours they're out there and they're not being, hydrated properly. Yeah. So not only is sickle cell disease important, it's important for everyone to get tested because even if you have sickle cell trait, your wife has sickle cell trait, guess what? You may have a child with sickle cell disease, right?
Yeah. Two traits would equate to a 25% chance of the anemia itself, which is, of course, a whole next level thing. And that's who I'm fighting for. Okay. Is the folks with the anemia.
Yes.
Because as we know, this is next level. What we know is that this access to care to this disease in Georgia and throughout the country, really, but certainly here in Georgia, and particularly in rural areas. I believe the stat is that over 60% of sickle cell patients are greater than 60 miles away from care.
That's right.
This is unacceptable.
Unacceptable.
By any metric. I mean, there's no other disease state that has such a lack of access to life-saving care. This is not, now look, again, with me, I have the trait. This is a low burn.
Right.
The anemia is a daily threat to your life. The seizures can be intense. The pain is excruciating. And the access to care is very few and far between. And this is the dynamic that I am most interested in intersecting on.
Right.
Nobody should be more than 5 or 10 minutes away from care they need to save their life on a moment's notice. You can't wait for somebody to have a sickle cell episode and then say, okay, well, let's get in the car and drive for an
2 hours.
hour and a half.
Right.
That's just not realistic.
Right.
It's not fair.
Right.
It's not just.
Right.
And it's just not the case with any other disease.
Right.
And until we bridge that gap, our work is not done.
Our work is not done.
Until every sickle cell patient in Georgia is 10 minutes or less away from care, our work is not done. Until we are doing everything that we can to support the families. We obviously want to support the sickle cell patient,
Absolutely.
but let's understand what these families
the
are having
caregivers
to endure
and the
too.
siblings, yes.
The caregivers that have to go to work, the caregivers that know they could get that call at any time, the caregivers that have to adjust and modify their life to make sure that their loved one is taken care of. These families need support too. It's the patient first and foremost, but if we look at the families as a whole, these are families that need support. These are families that deserve support.
Right.
And until they're getting it in a way that is at least equitable with every other disease state in Georgia, our work goes on.
Yes. And then you have to think about it, Andy. The family unit is so critical. And let me tell you how they're impacted. When a person has sickle cell disease, so you're talking about anemia, that's SS. There's SC as well, there's beta thal as well, but SS seems to be the most complicated form of sickle cell disease, right? And so if a child starting out has sickle cell disease and they're going to school, right? And after that child keeps calling, the parent have to keep leaving work, what happens? The parent end up getting laid off from their job because you're always out. Child is hospitalized, or the other dynamics. My child is hospitalized, I can't leave work anymore because if I do, they're gonna fire me. Then the child is all alone, right? Or you have a sickle cell young adult who now has a job, was able to get hired because they're educated, they are feeling good about themselves. And after they've missed several days of work, the same thing. Employer's like, hey, what's going on?
That's right, yeah.
Then they're hospitalized and they miss a week of work. They're let go as well. So now you have a family unit that's really struggling financially. And so that is for access to care, a lack of health care because a lot of them don't qualify for Medicaid disability, which they all should. And then we have the fact that they are struggling just to meet the day-to-day basic needs and necessities of a family. And so we also have to think about not just that they have sickle cell disease, but think for a moment, they still have all of the regular health issues that an individual may be facing, and I don't think that we take that into consideration. And more importantly, you said something about SS. When a person goes into a sickle cell crisis, I want everyone to really understand the sickle cell crisis. They are being deprived of oxygen in their body. And so when you're deprived of oxygen, guess what happens? You can go brain dead, your liver, your major organs can fail. So sickle cell disease, when they show up for a crisis, acute chest syndrome, they need immediate care. And most people dismiss them, and they'll let them sit out there in the emergency room and make them wait because sickle cell doesn't have a look. Like when I look at you, can I tell you have sickle cell trait? No. When we think about Kadeem, we look at him. Does he look like he have sickle cell? No. There are some signs, of course, the jaundice of the eyes, but it could be hepatitis or something else. It doesn't necessarily have to be sickle cell. Yeah. So sickle cell doesn't have a look, right? Yeah. But I want to thank you, Andy, for always advocating and bringing awareness to this horrific disease. But more importantly, tell me about what you've had to go through from the $0 in the state budget that we started with till 10 years later, we're now at 2.7 million, right? And we've had to work hard to get there.
Very hard.
So can you tell us what you had to go through and help bring awareness to the disease, and then also to just get us in the budget, and then what we had to do to grow the budget?
Yes, it's been a just an amazing, revealing, mostly successful and challenging journey. So yeah, as you said, when I first came on sickle cell about 10 years ago, officially on board, kind of into an official role with as opposed to just my volunteer role, one of the first things I really wanted to take a close look at is how much money does the state, invest in sickle cell care? And as you indicated, it turns out that number was exactly $0.
$0.
This should offend everybody.
Yeah.
Again, unacceptable, right? This is not acceptable. And so one of the first things we set out to do is say, hey, until we are, as a disease state, represented in the budget like other similar disease states in terms of incidence and impact, then we have work to do. Again, so I went to, I did a lot of research, found out we had no money, found out what other disease states did have in the budget. And I went to one of my close friends in the Senate at the time, and I want to give her a shout out. Former Senator Renee Unterman, I'll make sure I send her this clip. She was at the time chairing the Senate Health and Human Services Committee, and she was also chairing the Senate Appropriations Committee. And they are the ones who put money in the budget. Well, as most people will tell you when we get into lobbying and into politics, one of the hardest things to do is get into a budget. Once you're in, it sometimes is a little easier to grow it as long as you're producing results that you can show the state. But we had to break in the budget. And I went to my friend, Senator Unterman, at the time and talked with her about this, talked with her about the incidents and laid out the whole picture. And I said, Senator, if you are willing to just put any amount in the budget so we can just get a toehold, just a toehold in the budget to build off of, I will take anything. But I said, I really want the line item to be clear that any money that would go in would go to the Sickle Cell Foundation of Georgia, as opposed to just broadly the
sickle cell
the condition where it could get siphoned off in any number of directions. And that first year, she put in the budget for us $150,000.
Yeah.
Now, understand that, the budget in Georgia is about $40 billion a year. So when you're talking about $150,000, we're talking about chump change. You're
talking about a quarter penny.
Talking about a quarter.
Right.
And so, but I told her, look, just get me a toehold. And she did. And I really I just, the sickle cell community in my mind owes a great deal of gratitude to former Senator Renee Unterman, because she got us in there.
Yeah.
And from there, the conversations we had that you were a part of, we'd come back and we'd have all these staff meetings in between. And I said, what we have got to do is, no matter how little we get, we got to get bang for the buck. We can go back the next year and say, hey, your investment in us has saved lives. It saved the state dollars, and we want more.
Right.
And, so I said, whether they give us $10, whether they give us $150,000, we're going to get bang for the buck. And we did.
We did.
So we started investing that in ways that were very quantifiable, very measurable, very demonstrable. We wanted to be able to show the state, if you invest in us, you will get back more than you invest. And we built and built and built. I think the second year, I believe we got about another 250,000 in. That stacked on our 150, so that took it up to about 400. And then every year we built this budget incrementally. And one of the things that we took great care to do is, number one, we were very, very intentional about getting into the areas where the access was the least. And where the need was the greatest. And that didn't mean that we looked away from Metro Atlanta, but we knew in these rural areas it was tough. We knew we had a tough situation in Atlanta, but we started, and we knew from experiences like mine that there were a lot of folks in the physician community that didn't even know what this disease was, or if they did, they didn't know where to send you. They didn't know how to treat it. They didn't know what to look for. So we started doing physician and mid-level trainings all over the state.
Provider training.
Here's what you look for. Here's where you can send them to. And that became visible. And we invited legislators to those events. Come see what we're doing. We want all the lights on. We want transparency. We want you to see what we're doing, because we are getting bang for the buck. We started setting up satellite centers in some of the high population areas. We were doing so much. And legislators saw it. And the reason they saw it is because every year our budget went up. And you mentioned the $2.7 million we have in the budget now. Understand that came from zero. That came from hard work. And you only get increases in the state budget when you can go back every year and show the state, here's what we did with the funding you gave us last year. Here's how many people we served in your district, Senator. Here's how many Georgians we served. Here's how many cases we detected. Here's how many ER visits we prevented. These were all, every year, this is part of our messaging. We do our lobby day at the Capitol where they see us show up in force as a community. But we communicate with them one-on-one throughout the year. We have set up study committees. We got sickle cell added to the medicinal marijuana approved list. We got a vanity license plate that I always have to plug.
Yes.
So here's my look at the camera moment.
Yes.
On your birthday.
Yes.
You are going to have an opportunity when you go to renew your car tag. There will be a little drop-down menu, and you'll be able to select a whole range of specialty license tags, and you have to pay a little more for them, but there's one for sickle cell.
Yes.
And if you go in there and you scroll down and click on that sickle cell, that tag will cost you a little bit more, but a lot of those proceeds will come right here to the foundation, and we will reinvest those funds into your community to help people. Make sure you, on your birthday, get your sickle cell license tag. It helps us advertise. Tell your family, tell your friends, go get your sickle cell tag.
Yes.
There's one on every car in my family.
Yes, yes. And let me talk about something you just said. There's a few things that you said in here that I want to make sure I quantify and clarify. So when you're talking about that we had evidence and proof of our work, so we have our mobile unit.
Yes.
And we took our mobile unit and we outfitted into a clinic. That's right. And then we took a hematologist and a nurse and a community health worker on the road to these rural areas. So we're talking about Augusta, Columbus, Hinesville, Macon, and Savannah, right? And we're still reaching out
in
all parts in between,
right?
Along
the way, yep.
So we were sending our hematologists on the road to treat people where they are, understanding that they did not have, access to care.
That's right.
So then secondly, the provider training. So we have Dr. Ekman, Dr. Powell, we have a community health worker, Kieselon Wright, Jeanette Newman. So we have that group that's on the road going to non-specialty providers, showing them how to take care of individuals with sickle cell, because of course it's not that many hematologists left anymore. Right. A lot of them are retiring.
Right.
And then it's very hard to attract hematologists to the sickle cell space because of the CPT codes.
That's right.
Because they are paid less to treat sickle cell than they are to treat oncology. That's right.
It's another injustice.
And it's another injustice, and we'll talk about that later. So, and then we had a third party, non-biased auditor that audited our books. And so every dollar, every penny that we get from the state, we can justify where the money is going. And like you said, we were able to share and have them come here to this beautiful sickle cell sanctuary. And a lot of people don't understand, the sanctuary was founded and born because of the Atlanta Medical Center closing down. Right. So although we do have more hospitals that's born here, here inside of the Atlanta, Georgia, metropolitan area, the one hospital that a lot of our sickle cell warriors were using was Atlanta Medical Center. Yeah. They closed down. And so you and I started talking. Right. And then I had the whole vision, like, let's start one here and bring all of our sickle cell warriors to us, and we could treat them. But then we stepped it up a level. We didn't just want a hospital setting. We wanted something warm, inviting. We wanted to feel good, look good, smell good, right? And then we have the right staff that know that when our people present, they're presenting because they're in a lot of pain. So we know that just the atmosphere by itself can bring your pain level down. So the foundation was founded and we opened it up. The sanctuary was founded. We opened up our doors June 18th of 2024. So we just celebrated our 1-year anniversary. And I'm proud to say that we're seeing about 200 or plus, sickle cell warriors on a monthly basis. And that number is growing. And a lot of people ask me, like, Tabitha, you always start with the adults. Why you start with the adults and why not children? Well, many people don't understand that children are protected in our healthcare system, right. CHOA and Grady and all of them. So they are taken care of. They're like in this little cocoon. Yeah. But as soon as they transition to adult care, it's a totally different animal. Right. They're now responsible for their own care. And what they end up finding out is not a lot of doctors and providers and resources available for adults. And so that's why we started with adults. But starting next year, 2026, we will invite them here to the sanctuary as well for children to come and have these great services that we offer. So we have our hematologist here. We have our nurse practitioner here, a registered nurse, a director, office manager. So we got a full swing, I don't want to call it a clinic, but a sanctuary. But we offer all the services that you can get if you go to the hospital. And we are bringing on blood transfusions, blood exchanges, and pain management next year going into 2027. So I'm really excited that the money the state did give us, we were able to expand on it. And you know, when you guys came over to visit and tour, I remember how emotional you was about that. You know, and the same thing when our sickle cell warriors came to tour, they was very emotional. And it just hits your heart in a different type of way when you see that you are making a difference in the lives of people who have been inherently mistreated for so very long.
Yes. I mean, I couldn't say it better. You know, I will say, you know, to me, to date, we are still growing, but up to this date, you know, where we are sitting right now, you and I physically, right here in this room, in this sickle cell sanctuary, and I love the name of it so much. It is a sanctuary.
Yes.
And you know, this facility is beautiful.
Thank you.
And this facility is first class in every way. And one of the reasons, other than the obvious, that is so important to me is that this is a community that historically had been left behind.
Yeah.
And you know, what we were not trying to do with the sanctuary is, you know, find the broom closet in some half dilapidated old, like I want our sickle cell warriors to walk into an environment that feels first class, not secondary.
Yes.
Not, oh, we got the backside of a building with a broom closet.
Yes.
I want them to come in here and feel like I am about to be treated in a world-class, first-class way. To me, what this sanctuary embodies is, again, to date, to me, this is the representation of a decade of work, of trust building with the Georgia General Assembly that has allowed them to feel good about increasing our budget every year. We feel good about bringing legislators here to see the first class services that we're delivering. But this is a beautiful building with beautiful services that are, as you said, still growing, and folks are going to walk into this place and they're going to feel cared for holistically.
Right.
We're not sticking a needle in them or an IV in them and doing some wham, bam, and out. This is a, hey, do you want to go do your body mass index on this? Do you need to relax in a massage chair room? Do you need mental health counseling? We are serving the whole person. So to me, the very building we are sitting in, and the reason I was emotional about it is, you know, I can't explain to you how good it feels to have just been a small part of making this happen.
Yes.
And as I walked around this building, kind of in the soft opening, I was envisioning our patients who are used to a lower standard.
Yes, cold, sterile, hostile.
I was envisioning them walking in here and having a feeling of not only am I going to get good care, but I'm going to be respected by this environment.
Yes.
And it's just a very deep feeling with me. I mean, I want these folks to walk in this building and just feel just 360 degrees of care and love, and you matter here. You're not a widget. We're not checking a box. And just the way this place has been designed really represents the pinnacle of a decade.
Yes.
Of work. Now, we're not done growing. We're not done growing the sanctuary. We're not done growing with the General Assembly or across the state or the satellite centers we've set up or the mobile unit, as you've said. You know, another thing we did this last year that I don't want to fail to mention again is there was a bill that came along with regard to fertility preservation. So we know that with certain diseases, sickle cell being one of them, that your treatment regimen alone can render you infertile.
That's right.
Male and female.
Male and female.
So for those folks who want to have families, but they undergo chemo, whether, you know, cancer, whether they undergo sickle cell treatment, or there's some treatments for lupus that can render you infertile. And, you know, again, think about our patients here. You're already fighting this.
Yes.
You're already under-resourced with regard to access to care. You've already not been given the attention throughout your lifespan of other disease states, and now you might not be able to have a family. It's just devastation on devastation. So we passed a bill this year that requires. I love that word. Insurance companies to cover the cost of fertility preservation. This would be the freezing of sperm or egg prior to treatment.
That's right.
They must cover the cost for if you may want to have a family later and you're about to undergo sickle cell treatment, insurance must cover the cost of freezing of egg and or sperm so that on the other side of your treatment, you will still be able to have a family. This is what the foundation is fighting for.
Yes.
We want you to feel loved in your treatment here, but we want to protect your future too.
Yes.
We're going to cure this. We're going to be on the other side of this. And when we are, we want you to be able to have your family.
Absolutely.
So we're fighting for all of these things along the way at our state capitol, enacting laws, finding funding, turning that funding right back out into the community to get the care where it's needed the most in people's own backyards rather than asking them to drive an hour and a half to care. And it's just, it's a really beautiful feeling. But the culmination of it so far has been this sanctuary that we're sitting in now. And being able to communicate as we are right now throughout our state to our community to let them know what's going on so that they can better engage as well.
You know, I am a believer of being a doer. So a lot of people talk about what they're going to do, right? But we've not just talked about it. We have done what we said we were going to do, what we set out to do. We said we're going to do it. And I have so many people to thank for transforming this dark, dank space into this beautiful sanctuary that we have today. You know, I had an incredible team. You know, Sylvester Darnell was on the renovation team, came in and totally gutted this place out and redid the walls and the paintings and all of that. And then we had him and his team, you know, hands down. And then he beat the deadline. He told me like 4 weeks. I think he finished in like 3. Then we had this design team that came on board and they totally helped, you know, made it look so beautiful and serene and welcoming. And then we have this medical team that is just incredible to our sickle cell warriors because most of them had already themselves been subjected to how our sickle cell warriors were treated. Yeah. And so a combination of all of that together brings what we have here in the Sickle Cell Sanctuary. And I do want to give a shout out to Dr. Ashanti Hiltz down in Valley Healthcare, Columbus. And I was just on her show and she talked about, I'm bringing a sanctuary to Columbus. Yeah. And she's on a path to start, you know, duplicating or replicating what we've done here, which I'm really excited about. But then not only, you know, were we the first and only, we're no longer the only, but we still are the first that have brought a wellness center for sickle cell. So up in Howard Hospital in Washington, D.C., they now have a wellness center for sickle cell. I can't wait to visit because I want to see what it looks like and feel like. And then over in California, Kayan Wellness, they started adding parts of the wellness center as well. And so they gave us a shout out. So I want to shout right back out to them and say, thank you, because it's all a matter of we want this duplicated in every city, every state we possibly can, because at the end of the day, our sickle cell warriors are getting what they need. So it's never been about me. And it's like, oh, you know, people are taking your idea. I want them to steal this idea because it's a great idea. Yeah. And start wherever you can start. You don't have to start with everything that we started with. And so, of course, you know, people can get IV hydration here, as you talked about the mental health therapy. We now have 3 therapists because guess what? When you have sickle cell crisis and you're going through this chronic pain all the time, you have to think about the mental psyche of a sickle cell warrior. And not only are they impacted by the chronic pain, but they are impacted by the stereotypes, the racism, you know, course, yeah. The fact that they're missing schooling, they're missing work, and, you know, they're unemployed or getting fired. So there are so many other mental challenges that's going on with the family. I remember this one family called us like, can you please educate my parents? Because they don't really understand what I'm going through. And so I don't feel like they're there for me. I feel like I'm alone. And so we got 3 mental health therapists here now. And then we offer the IV hydration and infusions. We offer the biometrics, as you were talking about, reflexology, the massages. But then we have traditional care, hematology care, and the regular care that we're giving to our clients. We can write prescriptions now. We accept insurance now. And so we're looking forward to just like really, really growing. You know, we have 8 insurance companies. We're hoping to add many more on. And that insurance that you talked about, I'm going to tell you why that's so important, the fertility bill. When some of our sickle cell warriors went through gene therapy, that was one of the major impacts, that if they went through the gene therapy to get cured of sickle cell, most likely they was going to be infertile because they use a cancer drug, and so they were not going to be able to have children. So this is going to be so huge for that. And I need to do a little bit more research into that actually. And I will, and we'll come back and we'll talk about it. But gene therapy is a process that a sickle cell warrior can go through and get cured of sickle cell. But here's the sad part about that. That bill is either $1 million or $3 million. What sickle cell warrior do you know have that type of money for that type of access, right? So you have to go through a clinical trial. So someone went through a clinical trial and they was healed. But even what we're finding out are for the people that were healed going through the clinical trial, there's a mental process that go along with that too. So although they was healed of sickle cell, they wasn't healed of the mental trauma that they went through with sickle cell. So we're still working on that. And so, Andy, I tell you, we've done a lot of great work, but we still, to the day, have a lot of great work to do. And I want to thank you so much for being here. I want to thank you for the education. I want to thank you for the hard work that you continue to do for not just the Sickle Cell Foundation of Georgia, but for sickle cell as a whole. And I'm so excited that you guys joined us on Beyond the Show today, because here's what we want you to know. Sickle cell is real. We want you to tag us at Sickle Cell GA. We want you to share this video. We want you to like it. We want you to share with as many people as possible, because we know how important Beyond the Show is going to be to so many individuals, not just living with sickle cell, but impacted by sickle cell. This is just the start of something so phenomenal happening. So come back next week. We'll see you at the same time.